We're here to talk about health information technology, also known as health IT. To understand more about health IT, let's talk about some of the reasons why it was created. In 1999, the Institute of Medicine published a report to Air is Human, Building a Safer Health System. According to this report, there was as much as 98,000 deaths that were attributed to medical errors. In 2012, it was reported on an article from Forbes that the cost of healthcare per person has skyrocketed. In 1958, according to the article, the cost of healthcare per year for a person was $134. In 2012, the cost has jumped to $8,953. So, what exactly is health information technology? According to healthit.gov, health information technology is a broad concept that encompasses an array of technologies to store, share, and analyze health information. In other words, it is an array of technology that was created to improve the efficiency, quality, and cost effectiveness of healthcare. So now that we know what health IT is, how does it help? Well, previously, healthcare facilities utilized filing cabinets like the ones in the pictures for paper copies of medical records. Not only do they take up a large amount of space in an office, but they are also hard to share between healthcare providers. Patients would also have to retell their records every time they visit a different healthcare facility. And the retelling and copying of patient records can create multiple and inaccurate patient records. This type of record keeping requires more manpower, which in turn costs more, not to mention the possible dangers that can occur when a crucial information is missing. A function of health IT is the electronic health record. To put it in simple terms, it is a computerized version of the paper records. The advantage of this is that specialists and other members of the healthcare team would have easier access to a patient's file since it will be in a central database that can be accessed and updated easily through the use of workstations and computers. Moving forward, many plan the EHR to be interoperable. Currently, records are only shared by facilities under the same organization. Interoperability allows other organizations to share information between them. Another thing moving forward is the full utilization of the computerized physician order entry. CPOE is being used already in some facilities, but is not 100% yet. CPOE basically does away with handwritten orders for tests. Tests would basically be entered through the computer. Another function of health IT is e-prescribing. How many times have you seen handwriting like this? With e-prescribing, illegible penmanship is not an issue anymore since prescription information will be sent directly to pharmacists electronically. This decreases the chances of handing out the wrong medication. The use of e-prescribing also requires healthcare providers to check an online registry that lists all controlled substances recently prescribed to a patient so doctors can spot a history of abuse. Another benefit is that the theft of prescription pads for the illegal acquisitions of controlled substances would also be reduced. Those were only two of the many positive applications of health IT. More research is being done with how technology can still improve healthcare.